Hi, my name is Megan Doyle. I'm one of the team managers in one of the adult social work teams for Vale. When COVID initially started, quite lucky we work in the Upper Valley team, so Todmorden, Hebden Bridge and Stourbridge, and we're used to reacting to things changing because we've had to deal with the floods on 2 occasions. So you kind of have to act quickly and move with the time and really work with your community to make things happen. So the team are really good in adapting in terms of actually we do work with people who are older, people who are going to be shielding, who have got other disabilities and are going to struggle to do shopping. So one of the first things the team did was create a food bank within our office. It wasn't massive, but obviously we were beginning to get phone calls coming through on our duty line in terms of I'm running out of things and I don't really want to go shopping. Or I've received a shielding letter, and we were able to kind of react quickly with that by offering them a bit of food to time over until obviously volunteer hubs were up and running, and we could get them an online shop. So that was a great kind of accomplishment, and we share our building with other teams within the council, such as re-enablement, but also health colleagues and the learning disability nurses, and we made it into a bit of a team food bank, so other teams were using that as well, which was great. One of our team members, Dave, has a lot of contacts from previous work with supermarkets and building food banks, so we're really kind of capitalising on his expertise and his contacts, which was fab. We also made contact with everybody who was on our referral list, who were waiting to see a social worker, to ensure to do essentially a welfare check and ensure that they had access to their medication and shopping. Again, this was prior to the hubs being up and running, and give them our duty line if things did change or if we had to act on anything. Do we get those things in place? Equally, all the cases that were allocated to the social workers all got a courtesy call from us to ensure that they were okay. If there's anything that we need to act upon and follow through on, that was done. We also have reviewed everybody who suspended their care. A lot of people have packages of care in place, but obviously due to the risk that having people in your home brings, chose not to have their carers coming anymore, or have family members move in, or in fact cancel their care. So there was around 70 people in Calderdale that did that, and the Upper Valley team made sure every single one of those persons was contacted regularly to see how they were getting on, and how they're managing without care, ensuring the providers who were delivering the care where they'd been suspended, that they were doing their weekly check-in calls. It was real lovely to see some providers, whilst they weren't doing the care call as such, they were going outside people's homes and speaking to them through windows, Skyping people as well, which is lovely to see people adapting that way. We've also been connecting with our care homes in our local area. One of our care homes particularly got hit by COVID. There's sadly lots of deaths, and we recognise the impact this has had on the residents, on the care staff, on the manager. So we organised for our local fire service and ourselves to be outside that care home. It was actually Mill Reed Lodge, to clap for them, to show our appreciation. We can only empathise with the situation that they've been through, having lost a lot of people, but we wanted to show that we were there in solidarity with them and supporting them, and we were there if they needed us, and we've kind of raised their profile as well. What a fantastic job they'd really done. So that's what the Upper Valley team have been up to. We are now adapting to our new normal, which is working from home and only undertaking essential visits, keeping contact as a team via Zoom, and adapting to undertaking visits and contact with the people via technology, which is interesting, and we are learning every day really. So that is the Upper Valley team and our experience of COVID so far.